Good morning, DSPs and families. I wanted to make a few videos to go through some of the equipment we're using to try to help everybody stay safe during the pandemic. What I'm showing you here is a non-medical grade mask designed for community use. It's similar to what has been described and put forth by the CDC to help prevent transmission and spread of the coronavirus. It's important to note that this mask by itself does not protect the individual against contracting the coronavirus, but it does hopefully help limit spread to other individuals. This type of mask, which is homemade and which I'm referring to as a community type mask, is designed to be worn when out in public, or sometimes it is used as a covering for other high-grade medical masks such as the N95s. Again, it should not replace social distancing, and when used by itself does not prevent contraction of the coronavirus. I wanted to show everybody how this mask works. Basically, it has rubber bands which are used as the ear straps, and it's constructed from shop towels, 2-ply. If you look at the mask, you'll see there is an upper edge which is marked nose and a lower edge which goes at the bottom of the face. Along the upper edge of some of these masks, you'll feel a rigid insert, which is a pipe cleaner. That is the part that should be on the top, and this other edge goes down by the chin. Not all the masks have a rigid insert, so if there's no insert there and both top and bottom are soft, it doesn't matter which way the mask is applied. To apply the mask, you basically take the rubber band straps, extend them over behind your ears, and then expand the mask as such. That provides coverage for the nose and face. You then press the pipe cleaner to mold it along the contour of your nose. When removing the mask, you want to first ideally wash your hands so they're clean. Remove it slowly by the straps, and then store the mask inside a paper bag. That prevents moisture accumulation. It's important to place the mask on your face when reusing it with the same side always going against your mouth and nose. The reason for this is that this side is considered clean. This side filters and catches material from the outside. The way this works primarily is by preventing the spread of droplets when you cough, exhale, or breathe out. If it is used as a community mask out in the general community, it is important to know that it does not replace social distancing. You still need to remain at least 6 feet away from other individuals. It can also be used as a secondary cover for the higher N95 grade masks to possibly preserve and extend the life, although this has not been definitively shown. Again, I hope this has been helpful, and we'll be making a few more videos for everybody.